So, and then I got a gift card for whoever gets paid up first. All right. Okay, so is everybody ready? Okay. So, infection control. The purpose. The purpose of this plan is to provide guidelines and procedures to help control the possibility of virus introduction into the workshop and to minimize the spread of any virus introduced into the workshop. Managers and workers are all responsible for implementing this plan. Our goal is to mitigate the potential for transmission of an infectious virus in our workplaces, and that requires full cooperation among workers and management. Only through this cooperative effort can we establish and maintain the safety and health of our workers and workplaces.
You're way too fast, sister. Way too fast.
Well, I haven't written down the words yet.
Oh, I can't.
Well, okay, one word I said. Okay, responsibilities. Managers and workers are all responsible for implementing this plan. Our goal is to mitigate the potential for transmission of virus. Okay. Only through this cooperative effort can we establish and maintain the safety and health of our workers and workplaces. It is the responsibility to workshop management to follow all federal, state, and local regulations and guidelines. Overview. This plan follows Centers for Disease Control and Prevention, CDC guidelines, and federal OSHA standards related to virus control and addresses. Engineering controls, administrative controls, social distancing controls, housekeeping, cleaning, disinfecting and decontamination, PPE controls, transportation, prompt identification and isolation of sick persons. I don't think so. Communications and training. All right. Engineering controls. The workshop will develop and implement engineering controls to assist in controlling the spread of any potential virus within the facility. These controls will be considered as economically feasible and practical. These controls may include, but not be limited to, the following: automatic door openers, automatic light switches, automatic flushing toilets, automatic sinks, automatic hand dryers, no-touch trash cans and bags, increased airflow, HVAC units introducing more outside fresh air, increase the number of hand washing stations, provide CDC-approved hand sanitizer, increase workflow to allow for a minimum of 6 feet between employees, and plexiglass shields should be considered if a 6-foot separation cannot be maintained. Next section, administrative controls. Administrative controls are key to controlling any potential virus introduction and spread within the workshop. The following administrative controls should be considered for implementation. All staff and employees should be directed to not come to work if they exhibit any symptoms of a virus. This includes temperature, difficulty breathing, increased level of cough and congestion. All staff and employees should be directed to not come to work if they have direct contact with someone with an infectious virus. Temperature checks. You got it?
I don't know, because I thought you said infection. Did you say that early on?
We already called it.
Okay, so bingos are over, so I'm just gonna finish reading this. Okay, so the temperature check should be completed by all staff, employees, visitors, for everyone, and vendors before they enter the workshop. Eliminate overcrowding in common areas to retain a 6-foot separation. Stagger lunch and break times to reduce overcrowding. Post social distancing guidelines. Post hand washing guidelines. Require hand washing 3 to 5 times a day in addition to before and after breaks and lunch as well as restroom breaks. Okay, housekeeping and virus control. A key area of controlling the spread of a potential virus is implementing aggressive housekeeping and cleaning of common areas following CDC guidelines. At a minimum, the following areas will require additional cleanings and disinfection. Restrooms, sinks, door handles, handrails, tabletops, and kitchen facilities. Using CDC-approved cleaning products and techniques is imperative. Individuals completing the cleaning should wear all necessary PPE controls. The use of PPE is another important tool to reduce the possibility of virus spread. There are several PPE items which could include the following: eye protection, gloves, face masks, and face coverings. During times of infectious virus spread, it is recommended that all employees and staff wear some form of face mask. Most employees will not need to wear the N95 mask. These masks should be reserved for designated first aid staff or other staff which will be directly in contact with someone with a potential infectious virus. All other PPE use will be dependent on the job activity or function being complete. Refer to the PPE policy and PPE risk assessment checklist to help determine the type and level of PPE needed. That's a lot of PPE. All PPE use will require documented training in the proper use, limitations, care or maintenance, and disposal. Okay, transportation. First and foremost, if you can suspend transportation during a pandemic, this should be highly considered. However, if you must transport, the following guidelines should be considered. The driver of the vehicle and any other aides on the bus should wear a face mask, gloves, and consider eye protection. Increase airflow into the vehicle. All passengers should be temperature checked before entering the vehicle. All passengers should be required, if medically possible, to wear a face mask while riding in the vehicle. And if possible, space passengers through the vehicle to help maintain social distancing. After each run, the vehicle needs to be cleaned and disinfected using CDC guidelines. Some specific areas to be cleaned include seats, handrails, doors and door handles, seat belts, windows, and other common touch points. The key to disinfecting is following CDC guidelines. Proper PPE should be worn by individuals cleaning the vehicle. Sick person. Isolation guidelines. All staff should be trained to quickly identify any person showing symptoms of a contagious virus. If a potentially sick employee is identified, these guidelines should be followed. The sick person should be given a face mask and immediately brought to an isolation room. The work area where the employee is located should promptly be cleaned and disinfected following CDC guidelines. This person should remain in this room until they can be safely removed from the building. Once removed from the building, the room should be cleaned and following CDC guidelines. Identify all employees who have had close contact with sick employee, and then the sick person should be promptly tested for the contagious virus. Positive test results. If the sick employee tests positive for the virus, the following steps should be completed. Provide the list of all employees in close contact to medical personnel and locate health officials. And notify the legal guardian of all exposed employees. Okay, some universal precautions. These precautions are recommended by the Centers for Disease Control and are designed to protect staff and individuals from exposure to HIV, hepatitis, and other bloodborne diseases. Identified precautions should be used at all times and not just for persons having known or suspected infectious diseases. So we'll go through the procedure here. It's wear gloves when touching blood and body fluids,
mucous membranes or broken skin when handling items on surfaces soiled with blood or body fluids, and when performing vascular access procedures. Change surgical gloves between each client. Discard used gloves immediately into designated waste container. Do not attempt to wash or disinfect used gloves. Wash any skin surfaces immediately and thoroughly if they are contaminated by blood or body fluids. Wash your hands immediately after removing your gloves. Take precautions to prevent injuries caused by needles or sharp instruments during procedures. Also take precautions when cleaning used instruments and equipment and disposing of used needles and lancets. After use, place disposable syringes, lancets, and other sharp instruments in nearby puncture-resistant containers for disposal. Do not attempt to recap needles or lancets. Consider minimizing the need for mouth-to-mouth resuscitation by keeping mouthpieces nearby. If you have open or weeping skin lesions, do not give direct client care or handle client care equipment until the condition resolves. Clean blood or body fluid spills promptly with 1 part bleach to 10 parts water. If you are pregnant, be especially familiar with precautions and follow them closely because of the risk of transferring infection to the fetus. Okay, infection control tips for use in residential settings. Actively supervise and encourage client hand washing. Be certain you are providing good modeling behavior to your clients by frequent hand washing, especially before meal and medication preparation and in between any direct client care or treatment. Encourage clients to develop and continue safe personal hygiene and toileting skills. Female clients may require additional instruction on good personal hygiene when menstruating. Practice universal precautions when handling any blood or body fluid. This also includes the handling of any soiled particles such as clothing or bedding. Always immediately dispose of potentially contaminated gloves and other articles promptly in waste or specifically designated containers. Frequently review with staff and clients during staff and house meetings the importance of and specific procedures for infection control. Do not allow clients to share personal items which may be potential harbors of infection. Items may include toothbrushes, combs and brushes, towels, eating utensils, and medical equipment such as thermometers and AccuCheck lenses. Always have available plenty of surgical examination gloves and antibacterial soap. Do not reuse gloves. Contact your medical consultant if you suspect a client or staff member has a disease or condition which may be infectious, so proper infection control measures may be instituted. And last, encourage clients to engage in safe sexual practices. Remember, most of the time, a person with an infectious disease is not recognized by his or her appearance. Ta-da. And there are the sheets that everybody's on the table over the infectious controls and put that along with those.
We have an outside speaker that's due to be here at 1:30, so you have that long time.
How long will you wait?
1:30 will be the next speaker.
法律